Good morning, everyone, and thank you for joining us for another episode of Insights from the Couch with myself, Yalily Smith, owner of The Traveling Therapist, and Dr. Anamaria Ryan, owner of Seven Counseling, who is graciously agreed to be my podcast companion today as we delve into the world of mental health. Today, we're going to be talking about the differences between psychiatrists, psychologists, and licensed therapists. We're going to just like in as short and concise of a way as we can. We're going to kind of describe a little bit of the different roles and responsibilities that each one has so that you guys have a clear idea of what you're talking about whenever you're asking for these particular services. So, welcome, Dr. Ana Maria, and thank you for joining me.
Thank you, Jalili, once again for having me. It's always a pleasure doing this with you.
So, we started implementing psychiatry. Uh, we're almost at a. We passed a year this month, April of last year. We started implementing psychiatry, and that opened a whole nother world for us, where now we're also doing medication. And one of the things that we get phone calls for is the patient will call and say, "Oh, I'm calling because I need services." And then we ask, "Do you need medication management? Do you need talk therapy? What do you need?" And they'll be like, "Oh, I just need to talk to a psychologist." And then we'll tell them, like, we don't have psychologists in the building, but we have licensed therapists. And that's where sometimes we lose them because they don't know what the difference is between the two. Um, or they'll
Yeah,
say, "No, I don't need meds."
that's right. Or they're looking for meds.
Or they are looking for meds.
That happens to me all the time, actually. And so I believe that partially the confusion stems from media, and the things that have been fed to us in our heads. A lot of people are like, oh, am I going to get to lay down in your couch? I know that the name of the
So true.
podcast is Inside of the Couch, but literally, if I had one person or two in my whole career that wanted to lay on the couch because they were tired, that's what we did. But psychoanalysis is not a practice that happens anymore that often, at least that I know of. So we're not laying people down in a couch and we're not analyzing people, but people are confused regarding the roles. So sometimes my clients that actually have been working with me are like, oh, well, you're a doctor. That means that you can just go ahead and prescribe me the antidepressant that I need. And I have to clarify, well, I'm not an MD. I'm a PhD. So a lot of work, but not the same. We can probably start by saying that psychiatrists are medical doctors, MDs, that once upon a time, long time ago, used to do psychotherapy, maybe last century, early last century, but that started changing, and that's how psychologists and therapists took over to do the part of the therapy part, not the medication. So if you're looking for medication, most likely that's going to be an MD or a nurse practitioner, a medical professional.
That's true. It used to be where psychiatrists were the only mental health providers. This was many moons ago. And then, much like how it's happening now, you have you saw a transition of mental health where psychiatrists have mainly now moved on to, from what I've seen, it seems like psychiatrists are now mainly in managerial positions. They still see patients, but obviously very little psychotherapy happening. More than psychotherapy, it's management of medications, testing, managing nurse practitioners, signing off on their notes, making sure that when they see the patients, everything is in compliance, and then running practices or managing programs, things like that, teaching. So you see psychiatrists now have evolved to be in more of an overseer, almost kind of um, role rather than direct care.
That's true. Although it's worth saying that a lot of psychiatrists have great bedside manners still, and they care very much about their patients,
Mhm,
but that doesn't mean that they're going to sit with them and do an hour of psychotherapy, which is kind of like where we come in
mhm.
as psychologists or licensed practitioners, clinicians. And maybe we should touch on that aspect as well. But before we move to that, I wanted to say something, if I may. This is just a personal belief, and you can just pitch in if you differ from me, but I think that sometimes when people have disorders that are related to mood, like, and legitimately, because sometimes some of us are born with certain neurotransmitters that are less or more. If I don't make enough serotonin, my body just doesn't make it. It's totally okay to take an antidepressant. And a lot of my clients ask questions about, well, am I gonna get hooked on those? What are the consequences? I don't want to take medications. I want to go the natural route. Those are good questions to ask your doctor about. Nonetheless, if you do have a legitimate mood disorder, I'm using DSM-4 language, I'm sorry, like anxiety, OCD, depression, and these things are organic, most likely you're going to need a little bit of help from medication. There's nothing wrong with that. It's
Mhm.
no different than having diabetes and having to take medication for that, or high blood pressure. So people have this obscure thought about what psychotropics do,
Yeah.
and I just wanted to throw that out there because, yes, we all want to manage things without medication, possibly. Like, I'm one of them, right? Like, I don't want to take pills. But when you have to, you do. And maybe 20% of your success rate with your outcome is going to be from the medication, and the 80%, the work that you put in therapy is probably that other side of it. So a combination between the two of those, when you legitimately have something related to your chemistry that is not working properly, is what I would suggest. I don't know if you're in agreement, but I think that that's where psychiatrists and therapists or psychologists, we work together
Yeah.
to help the person feel better.
Yeah. I was really excited um to have psychiatric nurse practitioners in the clinic that were good team players with the therapists, because they really took to the idea of being in the same space with therapists and with the therapists that were seeing their patients, because they can understand that unfortunately they don't have the time or even honestly the education, because they've spent more time in the medical field than they have in the mental health field. So they were grateful to be able to say, I'm glad that that have my patients who are being medicated are also under the support of a therapist who can spend that hour with them and actually provide psychotherapy. Um, and one of the things, to go back to your point, is the reality is that even though there are some conditions that maybe a mood disorder that can be addressed and eventually overcome, maybe through the use of uh, Spravato, like ketamine, or maybe through just the right combination of psychotherapy and medication, you can build those coping mechanisms. There are some mood disorders that you are always, and other types of disorders like schizophrenic disorders, where you are always going to need medication for the rest of your life. Like if you're bipolar, you will forever need medication and psychotherapy. If you have schizoid affective disorders like schizophrenia, you are going to need to be on medication for the rest of your life. And denying yourself that reality is only holding you back from getting your life in order so that you can start living. So,
So the flip side of not wanting to take medication are the folks who only want to take the medication, but they
yeah.
don't want to do the psychotherapy. So it is a humble suggestion to the listeners. If you're considering both, is probably your best bet.
Mhm.
So the psychiatrist is the one that is going to be in charge of evaluating you and doing medication management for you. And then B, us psychologists, licensed therapists are the ones that are going to be sitting with you, giving you the coping skills that you need with behavior and thought processes. And that's probably where we should talk about the differences, right? Like psychologist, how is a psychologist different than a licensed clinical social worker, a licensed mental health counselor? Because people get confused about all of those letters, right? Like when you have those letters after your name, it's like, what does that mean? Who are you? What do you do?
I want to say just one last thing about the medication part.
Sure.
Um, we do something in a lot of places too, something called gene testing.
Oh, yes. Thank you for
And
that.
I really like that because I myself am weary of of people becoming dependent on medication and having terrible side effects. So
Mm-hmm.
it's not that we don't see you and your concerns. 100% we know that these medications, psychotropics and benzos are highly addictive and they may not do well with your DNA and just your chemistry. So I recommend that you ask, if possible, for something called a gene test, a DNA test, where you get a swab done of, saliva swab of your mouth and it gets turned sent in, and then the psychiatrist or the nurse practitioner gets a very, very thorough report of all of the medications that are recommended for you individually, um, by through your DNA.
Thank you for bringing that point up, Jalili. And I think you can correct me if I'm wrong, but a lot of insurance companies pay for
Yeah.
that. Okay. And
Yes.
what I wanted to say about it, by the way, I'm just going to self disclose. I do have depression. And back in the day, trying to figure it out what medication was going to work for me was going through hell, literally. I was given Zoloft, and that made me lose more weight. I'm already on the lean side, and I lost a lot of weight. Then they gave me Wellbutrin. I lost my libido. Then they gave me something else. I felt like a guinea pig. So with I guess I'm gonna say Genomind is one of the tests that are used. I don't know if we can use the name, but the DNA test that you're mentioning definitely narrows down your options for what is best for you. Thank you. That was brilliant to bring that up. I tell my
Yeah,
clients to do that all the time.
because I used to say that psychiatry was like shooting darts in the dark.
Yes, absolutely.
To me, it is
Tool.
uh the only type of medical practice where you actually get to prescribe medication and there's no visual. There's no MRI, there's no CT scan, there's no, and you're playing with the brain chemistry.
And people actually react differently to a
Yeah,
medication. So if you do well with Zoloft, maybe I don't. That's
yeah.
important to mention.
Right. So, yeah, so if you do consider it, but you're nervous, you're not 100% comfortable with getting medication, then ask for we use GeneSight is the company that we work with, and most insurances will give you the prior authorization for it and approve it. Um, Most of the time, GeneSight themselves will turn in the prior auth for you, or the clinic will do it for you, and it's hardly ever, it's maybe a copay or something like that, but there's hardly ever an out-of-pocket expense, and it's worth it because it's a very thorough report. I've seen it, it's like 40 something pages. It's very, very good. So okay, now let's see the differences between psychologists and talk therapists or licensed therapists. Especially you, Dr. Anamaria, I think you can speak to the psychology part for sure, and then you are also a therapist, so it's perfect.
Yes, yes. Thank you so much for bringing that up. So my degree in psychology is in general psychology, and I was doing research. So sometimes people don't understand that there are different aspects of psychology or specialties. You have your clinical psychologist, which can do psychotherapy. You got people like neuropsychologists, which is a newer kind of a degree, and it specializes more in the biological aspect and the functioning of the brain
Mhm.
and behavior. You have forensic psychologists, you got a school psychologist, you got industrial organizational psychologists. So I just wanted to clarify that within the realm of psychology is not just doing psychotherapy. That would be a clinical psychologist, and you need a license to do this, like you needed to be a therapist. The only person that can do therapy with you is a licensed psychologist in terms of psychology. The other specializations are not directly for psychotherapy. So if you're asking for a psychologist, you could do psychotherapy with a licensed therapist too. The difference is that the clinical psychologist has um, more education, perhaps, and more exposure to patients for a little longer. But the licensed clinicians have master's degrees. They also have extensive experience with clients, and they have to every 2 years, renew their licenses. So I just wanted to put that out there for people to think about when they're. What is the difference between a psychologist and a therapist? I guess it's basically the same. It's just a little more education for the clinical psychologist.
That's right. That's right. So it's similar to like in therapy, there's social work, and so
Mm-hmm.
licensed clinical social workers who have completed their master's degree, then spend 2 years under the supervision of a licensed social worker. Then they got their own license, and then they get to practice on their own. Then you have registered interns who are those therapists that are have completed their masters and are in within the 2 years of working under a licensed practitioner that has been certified to supervise. So they also provide therapy as well under the supervision of a licensed supervisor for those 2 years, and then they take their test, and then they get to be independent. In the mental health side, like in the therapy side, licensed therapy side, you have licensed family therapists, you have licensed mental health clinicians, you have licensed social workers. Um, all of them do psychotherapy, all of them do therapy, but they have different specialties. So, a licensed social worker, for example, can be a kind of a jack of all trades. Um, it is I guess if you were to compare it to something, we're kind of like the firefighters of the mental health field. We get thrown into all sorts of situations when we're doing our internships. Some of us will work for DCF. I worked at hospice. We have others who work in hospitals with children. Um, others in nonprofits. So for this for social workers, for licensed clinical social workers, we learn about crisis intervention, we learn talk therapy, we learn psychoanalytical therapy, we learn cognitive behavioral therapy, we learn a little bit of everything. We learn about family dynamics and doing couples and families, a little bit of everything. Now you have the family counselors, which are licensed family therapists, and they tend to choose that as a specialty in school. And so they get an opportunity to have a little bit more knowledge, and that typically they choose that because it's their passion. And so you'll see them working more with specifically families, couples, um, things like that. They'll do individual, but they'll mostly try to do families and couples. And then the mental health is they're more of um, individual. They do a lot of individual work. Some of them do like to work with couples and families. A lot of them like to work with children. So they do a lot of the child therapy.
I do want to make emphasis on that aspect, if I may, because I'm also a licensed mental health counselor. And during our training, we get bombarded with theoretical approaches to therapy. So that's our main concern, is to be able to give you a plethora of techniques to treat whatever diagnosis you may be presenting with. And you're correct, that can happen at an individual base, group base, or
The
family.
macro.
Or the thing is that I don't know about my colleagues out there, but I definitely would say, if you're looking for a family or marriage counselor, it's probably best to go with that specialty, because they do work very specific approaches. When licensed mental health counselors are training, we touch very little on what that looks like, so
Yeah.
maybe we have a little bit of training with Gotten method, but I'm not an expert at that. If you're specifically looking for it, you should go with the marriage and
Yeah.
family counselor. Now, if you're looking for individual counseling for trauma, depression, anxiety, OCD, etc., personality disorders, I think that that's the meat and potatoes of the training for a licensed mental health counselor. So I just wanted to throw that out there too. But the licensing works the same for all of us, like you were explaining. We have to do extensive, not only training, getting a master's degree, but post education. And we're supposed to keep current, ladies and gentlemen, with all of information. We have to learn things about the profession that are coming out. So you can trust that you're in good hands, whether it is a clinical psychologist for therapy or a licensed clinician for therapy.
Yeah. I think also, um, in my opinion, when we go to school, we get, like Dr. Ana Maria said, a sprinkling of everything. Um, then you leave school. Now, mind you, again, maybe you did choose family as your specialty, and then you get a bucket full of that.
Yes,
But
of course.
typically for mental health and social work, you get a sprinkling of everything. Then you leave school and you get an opportunity to go into the real world, and you get an opportunity maybe to work with a number of population, like different types of people and patients. And you realize, holy moly, like this is the thing I love. Like I didn't realize it because my internship at school was on something completely different. But now that I'm in the real world and I've gotten an opportunity to work with patients, I just found out that like my passion is families, for example. Well, like Dr. Amaria said, like we are constantly evolving our training. And once we find things that we're passionate about, we go in and we do our certifications, we study and work on that particular area, and then we get good at it. So basically, what we're trying to say is yes, you can pick and choose based on specialty. For the most part, clinical psychologists and l- licensed therapists are going to be able to do a little bit of everything. They're just going to have their own personal preferences on what they feel most confident working on. So some of them may feel more confident working with children rather than seniors. Some may feel more confident working with families rather than individuals, or trauma, for example. It's just a matter of finding your right fit. And ultimately, in my opinion, because we do have a scarcity of couples counselors and family therapists, I would say, um, if you have a licensed therapist who has experience and who is comfortable working with families, working with couples, give it a try.
Or a clinical psychologist.
Or a
Sorry.
clinical psychologist, yeah, who actually is comfortable doing it. Absolutely. Um, give them a try.
Um,
We're not saying, I know that sometimes doctors will tell you, like, well, you have to do this. This is the type of, like we were just
Actually,
talking about CBT.
yes, newsflash for everybody out there. I don't mean to interrupt you, but you're going to get this type of advice from your medical professionals, your PCPs that are genuinely concerned about you, but they're going to say something that they learn in school very briefly, and they're going to throw the letters CBT at you, and you're going to be like, what is that? Maybe you will ask ChatGPT or Google it, and then you'll go to your therapist and say, I want to do CBT. Well, again, newsflash, most of us get extensively trained and schooled for CBT, but that's not the only approach to therapy. And it doesn't mean that is the right approach for you.
That's true. That's true. So basically, come in with an open mind. It's good to review that the professional, whether it's the clinical psychologist or whether it's the therapist, review their bio,
Credentials.
check out their credentials, check out, what populations they've worked with in the past, what populations they're comfortable with. Um, use the intake. Intakes are great because you have that first meeting, and that first meeting is an interview that goes both ways. It's a reciprocal interview. You can ask questions of the therapist just as well as the therapist is going to ask questions of you about your life and about what your trauma is and why you're here for therapy. Well, you can also ask the therapist, like, are you comfortable working with families? Is this something you have experience with? Would it be something that I can go to you to work with? Or do you recommend someone else in the practice, or, things like that?
If I may, I know that we didn't talk about this, but previously, but I want to throw it out there, if I may, very briefly, Jalili. And it is the fact that you can CAN choose to work with a coach. I know that coaching is one of those things that has become so popular, and coaches get certifications to do the work that they do. But if you're looking for treatment, if you're looking for someone who has a license and it's in line with the Department of Health and can offer more than a coach can offer, that's also something to think about, because I don't think that coaches take insurance. Correct me if I'm wrong. I
Yeah,
don't know
no,
that they're
no,
licensed.
they can't.
Uh, so maybe your coach, your health coach or your life coach can take you so far. But then if you want to do psychotherapy, if you want to get really deep into finding the solution for the problem, I certainly would suggest a licensed clinician. And our profession is protected because it's licensed and we are held accountable for what we do. So you got to kind of like think about that too. People are also seeing therapists that are not licensed, that offer services. You know, maybe somebody moved here from Spain or from Venezuela or Peru, and they or Europe. You know, they don't have a license, but they do practice therapy. So that could be something that you want to try on your own. But if you go with licensed clinicians or licensed psychologists, it's a different deal, because that is something that is regulated by the state of Florida.
Yeah. And I want to clarify um, that uh, registered interns who basically these are again
Baby therapists.
I'm sorry.
Baby therapists.
Well, in my experience, like I have people that work for me that have been in the field of mental health as registered interns longer than I have.
Oh, wow.
Yes. Um, that are probably better therapists than I am. But remember that until maybe 5, 6 years ago, it was okay to work as a social worker with even without having to register yourself to go towards licensure. It was okay for you to work as a social worker. I had plenty of people in hospice that did mental health that didn't have a license, but they did crisis management, they did grief counseling, they did family therapy. I mean, they did it. They got in there in the weeds. It doesn't come any harder than being in the middle of a death situation and you're doing family therapy. Um, so we do have our very, very early masters just completed their masters registered interns that are kind of being supervised and guided by licensed individuals. But and then we have registered interns that have a lot of experience that
Experience.
have are great therapists themselves, but just understand that they have to go through the 2 years minimum, but sometimes up to 5 years, because that's what you get, up to 5 years um, of supervised um, just care under a licensed therapist does not necessarily mean that they're not a good fit, um, and that they don't have any experience at all. It's again, it's very important for you to know the person you're working with. Use your intake time wisely. Read the bios. Um, like I said, I have colleagues that still don't have their license. They no longer care to have their license. They're better therapists than I ever could be. They've been in the field for 15 years. But there was a time when a license wasn't the thing to like you didn't have to have it with as much pressure as you do now.
This is true, but I guess I was mentioning cases that are very specific, because I am actually learning from a therapist that is not licensed and wasn't trained here in the United States, but I'm learning something specifically from her for my own personal growth.
There you
And
go.
so that's kind of like what I was mentioning, that if somebody moved from another country
No, no,
and
no,
they
no, no. That's
practice,
not no, that's not what I was talking about. I was just
okay.
saying I know we're saying the word licensed
Yes.
uh quite a bit, and And I just want to say that there's also people who are looking towards getting their experience so that they can get the license, but they don't have the choice to kind of bypass that part.
Sure,
It's
and
that's what I
that
mean.
no, and you're actually kind of like proving, not proving my point, but like saying the same thing that I'm saying, that we are held accountable to very, very
Yes.
rigorous, or rigid ethical code and the law. And that's why it's important to make sure that you go with someone who is actually a registered intern, has a master's degree or
Somebody who's
above.
under, if you're registered under, make sure that that person is under the supervision of a licensed professional.
Thank you. Yes,
Yeah.
absolutely.
You know,
And
so you can be somebody who is not licensed, who is not even registered, back to your point, Dr. Ana Maria, not licensed, not even registered in the state, not even registered in the state. That's what we're talking about. We're talking about somebody who is not licensed, not under the supervision of someone who's licensed, someone who is certified to be a supervisor, or registered in the state, period. They're just here with a license from a different country, and they're providing care, and it's fine as long as they're not like impersonating the credentials
correct.
of a legitimate therapist.
And also, again, the coaches don't have the work done that we have done in a master's program sometimes, or a PhD program. So just keep that in mind. There is actually a place for everybody. There's a person for your needs, but we're trying to help you understand the differences between professionals out there for you to make the decision that is best for you. I think that's what we're doing this morning. So I wanted also to say that I get a lot of people telling me, hey, can you go ahead and do this test for me? Hey, can you test my child for attention deficit? And just because I do have a doctor's in psychology doesn't mean that I can go ahead and do that. That is a very specific specialty, and there are psychologists that specialize in formal testing. So I, for example, do very informal tests with my clients, like the Myers-Briggs for personality, but maybe someone is requiring the MMPI,
Mhm.
and that is very specific. So I would say if you're looking for testing, you got to find that person that is credentialed to do the testing in the way you need it. I think, Jalili, you also do immigration related evaluations, and I don't know if you want to talk about that or testing in general.
That was actually that's one of the ones that gets, if I may say this word, bastardized the most.
The MMPI.
No, the immigration
Oh, the
assessment,
immigration. Yes.
because here's what you're gonna hear. I believe, I don't think everybody that I've talked to has lied to me. It has to be, because this is a pattern. This is what you hear from your lawyer. Oh, you just need to get a letter from your doctor or from a therapist that says that you should stay in the country or something like that. It's like it's the most general request known to man, no specifics at all. So we get a phone call. Oh yeah, I need a therapist evaluation. Okay, what the heck is that? And then they're like, no, I just need to make an appointment with a therapist. They come in, they do we take them in, we do their intake, which is the biopsychosocial, which is just, your first visit with the therapist. And then the person says, oh, I need a copy of that for my lawyer. And this is literally what is said every time. And then we're like, that's not how that works. A biopsychosocial is not going to give the information. It doesn't have the specific questions or assessments that are required for, say, a VAWA visa or U visa or hardship letter. I mean, you're gonna come in, you're gonna feel like you wasted your time. You're gonna take that note, because it's a note, it's not an official assessment. You're gonna take that note to the lawyers. The lawyers are gonna show it in court if they even not turn you around, and everybody's gonna be like, well, that's great. Now that we know your religious affiliation and the list of your medications, and whether you finished all of your childhood preliminary growth report, like, you were able to walk at the right time and talk at the right time, and you didn't have to have a special schooling, but nobody cares because that's not for immigration. So,
Another test that is very specific is when people are seeking hormonal treatment when they're transitioning. I know I have worked with many transgender clients doing just regular therapy, but when it comes to your hormonal treatment, folks, you need to get someone that has the right credentials to do what you need
yeah,
for that medical doctor to do your hormonal treatment. So that's kind of like what Jalili and I are talking about, not because we do a biopsychosocial, which is just an extensive history of you. It means that we can help you with certain specific testing.
yeah. So we do the immigration assessments here in the clinic, and we do an ADHD assessment as well. Um, that is that can be used for diagnosing purposes. And the and the immigration assessment is specifically tailored. The questions are specifically tailored, and the way the assessment is written is specifically tailored for a court of law to read. Um, so pick, make sure that you're going and you're asking the question for the assessment that you need, and like find the people that actually specialize in it, because not everybody does it.
And another thing that I think is important to mention is that your legal team, if this is a legal matter or is related to the law in any way, shape, or form, it's never a good idea to access therapy without telling your therapist that you are in the middle of a litigation. And because sometimes, well, all the time we would want you to be transparent with us, but the legal team doesn't necessarily know what the mental health is field is about, or what we do, or how we do it. So they may try to simplify things for you, but they're not really as simple as they seem on our end.
That's true. So, okay, I know we threw a lot at you, so I'm just going to do a super quick recap. Psychiatry and psychiatric nurse practitioners are fabulous, and please do share with them your symptoms, any changes in your symptoms, any changes to your medications and your lifestyle. However, they are not necessarily the people that you spend an hour talking to about your feelings. Um, then you have clinical psychologists. So when you're looking up for a psychologist, make sure that you're looking for a clinical psychologist, and they are more likely to do the psychoanalytical care, like the psychotherapy and talk therapy, et cetera, et cetera. You can also make sure in their bio if they do any type of specific testing, because a lot of them do testing. Look in their bio, see if they do specific testing, because those would be some of the people that you could do, possibly autism, possibly ADHD, et cetera, et cetera. But it has to be like noted that they do that. And then we have registered interns who are, as Dr. Anamaria said, baby therapists, and they make sure that they are under the care of a licensed professional and that they are registered in the state of Florida, and they have their own number. They have their own license number as well. Um, and they provide therapy just as well as a licensed therapist does also. Um, so when you're calling, if you're looking for talk therapy, you might be invited to speak with a licensed therapist or with a clinical psychologist. Both can do the work. So that's okay. It's fine. And just do your research on the person that you're going to work with.
You can actually look at the Department of Health website and look at the person's license or registered intern license, and it will give you all the information that you need to know regarding the status of that license or that registered intern.
Yeah, and most of us have profiles. We also on our websites, on social media, we have profiles where we also try to like share a little bit about ourselves so that you know what you're walking into. So we hope that this was helpful. We hope that we didn't get too confusing, because when we start talking in our own very special language, I know that sometimes sometimes the patient the people, just out in the community may be like, oh my gosh, well, now I'm more confused than when I first started. So hopefully we clarified it instead of confusing you guys even more. But we wish you luck in your mental health journey. We really, really hope that you find that one special person that will guide you well, that will give you the tools that you need to feel like you have something positive happening in your life and there's momentum happening. And we absolutely wish you many blessings and our love. And we can't wait to talk to you next time. And as always, feel free to ask us questions, send us your comments. If you have any ideas on topics, feel free to share. And we will be talking next time.
Thank you, Yalily, again for inviting me. And I hope everyone got a little something out of this discussion we had this morning. It was really interesting. Always a pleasure.
Thank you.